We're tracking several big stories about the impact of the pandemic. More schools are closing due to COVID. Butte Vista Elementary in Yuba County is closed through Tuesday. Lake Tahoe Unified also closing down today and tomorrow due to a shortage of staff.
And Sacramento County confirming new outbreaks at the main jail as well as Rio Cosumnes Correctional Center. Now, the outbreak is so bad, Sacramento County officials announced an emergency release of more than 230 inmates up to 90 days early. The low-level offenders will be released over the next few days to open up more room to allow the remaining inmates to space out.
Well, the highly contagious Omicron variant's now responsible for an estimated 98% of all new infections in the country. On average, more than 20,000 virus-positive Americans are being hospitalized every day. And to help ease the burden on overwhelmed hospitals, 1,000 military doctors and nurses will be deployed to 6 states next week.
As long as we have tens of millions of people who will not get vaccinated, we're going to have full hospitals and needless deaths.
Hopeful news in this Omicron surge is that new research that has not yet been peer-reviewed shows the variant may be less severe than Delta, suggesting those infected with Omicron are 91% less likely to die from the virus. They're also half as likely to be hospitalized and have shorter hospital stays.
Well, meanwhile, today, the Supreme Court stopped the Biden administration requirement that employees at large businesses get vaccinated or undergo weekly testing and wear a mask. The court's conservative majority ruled the administration overstepped its authority, but the court did uphold a vaccine mandate that covers most U.S. healthcare workers. Well, the Biden administration now promising free, high-quality COVID tests for every American. So here's how this plan is going to work, they say. The federal government requires insurance companies to pay for up to 8 COVID tests a person. You can either give your insurance information when you check out or file a claim after you bought the test. Your insurance should reimburse you. People can start getting reimbursed on Saturday.
Today, I checked in with a local infectious disease expert, and I learned that there could be a light at the end of the tunnel. It was surprising to me. I sat down with Dr. Dean Blumberg at UC Davis to get your COVID questions answered. When will COVID peak in California?
Some of the best models suggest that we already hit the peak in terms of daily infections in California. That should continue to decrease. This current surge should continue to get better.
What about hospitalizations and ICU admissions?
Those tend to follow by a week or two after the peak. And so what we're expecting is that hospital resource use is expected to peak in California sometimes toward the end of this month.
What do parents need to know?
We also know specifically, for example, with children, that MIS-C, the multisystem inflammatory syndrome in children, generally follows acute infection by 2 to 4 weeks. So if we saw the peak this week with acute infections, we expect more hospital admissions for MIS-C over the next 2 to 4 weeks.
After this, are we going to be done with variants?
I don't think we'll ever be done for variants. It's similar to influenza. I think there'll always be strains circulating. There's always going to be change in the strains that are circulating. But what we can hope for is that the variants will develop less frequently, and that as we build up at least partial immunity, that when we get these surges, that they result in mild infection because people have partial immunity either from vaccination, hopefully, or previous infection.
Now, as you might imagine, there is still some debate when it comes to Omicron's peak. Well, Dr. Blumberg there believes that we've already peaked in California. Sacramento County health officials say that they expect it to peak here between late January and early February. And more potential good signs on COVID coming from wastewater. Yeah, you heard that right. Officials in Santa Clara County first detected Omicron in wastewater, and ongoing surveillance now shows a dip in cases. Unfortunately, they're not seeing a reduction yet in hospitals, but that should follow.